waiting for one more. Everybody here is a very important guest, so look around, and it doesn't matter who you're sitting next to, you are a VIP. Okay. Also, so excited for the turnout, and sorry we don't have more chairs. It's a standing room only event. But yes, we are waiting for one more speaker this morning, but we're just going to go ahead and get started in the interest of everybody's time. Good morning, everyone who's here celebrating with us for this joyous occasion. I'm here with our board chair, Cynthia Lachard. And with so many members of our board and our BNHC team, including our senior advisor and longtime CEO, Sue Joss. I am here to celebrate this moment. We do want to welcome some special guests. Aside from the fact that I said everybody here is special, we also do want to honor Congressman Stephen Lynch. I'm going to go through a list of many names, and then some special thanks at the end. So maybe we'll reserve the clapping to the special thanks, to the special shout out portion. Michael Curry, Here's the person. Massachusetts Department of Public Health Deputy Commissioner and Chief Medical Officer, Dr. Jessica Zeidman. Multiple team members. I love it. I love the spirit on a Monday morning. Multiple team members from DPH's Bureau of Substance Addiction Services and the Office of HIV/AIDS. State Senator and our friend Senator Mike Brady. Our incredible and supportive state representatives of Brockton, Representative Michelle DuBois, Rita Mendes, and Bridget Plouffe. Mayor of the City of Champions, Mayor Bob Sullivan, and his incredible Chief of Staff, Sydney Merrow. Yes. And state and national community health center leaders as well. President and CEO of the Mass League of Community Health Centers, Michael Curry. President and CEO of the National Association of Community Health Centers, Dr. Q. Reed. He came in all the way from Washington, D.C. and also Needham, where he actually I shouldn't have said that. It should have been way more bigly to say something else. Okay, community leaders, our hospital leaders and friends from our local hospitals, Matt Hesketh, Tony Phelps, and Nancy Lopes from BMC South. And Bob Happy, President of Signature Brockton Hospital. Thank you so much for being here. We also have special guests, community partners and leaders, Marlene Amedi from Haitian Community Partners, a good friend. I don't think Moises Rodriguez has arrived yet, but I'm assuming he'll come right before we finish. And business partners who help to bring these projects and drawings to life, Lero Architects, and the builders of our vision, the team from Sterling Construction. So thank you so much. Then of course, we want to say hello this morning to our amazing board members, some of whom, 50% of whom I think are here today. Raise your hand briefly. That would be Eli Teixeira, Joyce Rain Anderson, Antonio Barros, Moses Sawali, Arthur Depina, Mary Jane Anin, I don't think has arrived. Yes, Mary Jane! Yes! And Felicita Sepulveda. And Antonio Barros, don't know if I mentioned, yes, who is our very newest board member. So thank you all for being here today. This is a proud and exciting moment for our team and the community we serve. We are thrilled to be completing the renovation of these clinical spaces designed to help us provide more care, more access, and more comfort to our patients and our staff. This morning, we are here to celebrate clinical expansion projects for our 4th and 5th floors. These projects have expanded clinical space for eye services, primary care, substance use services, and infectious diseases. Through this expansion, we were able to increase our eye services department from 9 to 12 lanes, and you can see that when you go downstairs, which allow us to offer at least 2,400 additional visits a year, including visits for children, which means more kids, and I'm saying this as a mother, with a child with a pretty severe astigmatism. More kids who are struggling to read in school will have easier access to care that will help them to engage more in learning. This project expanded our primary care access by 17 exam rooms and made it possible for us to co-locate substance use services, infectious diseases, a re-entry program, and primary care. This means we can easily get same-day access between the infectious diseases team and our substance use services teams, which is more efficient for patients and for staff. This project has also made it possible for BNHC to build out its first ever negative pressure room, which has become particularly important to maximize staff and patient safety as we address TB and other infectious diseases. Healthcare is certainly experiencing unprecedented uncertainty, and BNHC more specifically has certainly experienced our fair share of challenges over the last few years. However, it is in the face of these challenges that it is most important for us to come together in community with each other, in gratitude and in joy, to celebrate achievements like this. Celebrating doesn't mean the work is done. It doesn't mean that everything is all right. It means that we recognize the strength it took to get here, and we honor the people who made it possible. In the spirit of recognition and honoring, I would like to thank some special individuals without whom these projects would not have been made a reality. As you are being thanked, I would appreciate you to stand up and wave for everyone to clap for you. First, I want to thank Congressman Lynch for securing congressional funding, and in general, without whose leadership this renovation would not have been made possible. Thank you for your relentless support for BNHC, the work that we do, and our mission to keep our community healthy. I wish to thank the Massachusetts Executive Office of Health and Human Services, represented here today by Mass Department of Public Health Deputy Commissioner and CMO, Dr. Jessica Zeidman. That you will all see today possible. Please extend, Dr. Zeidman, please extend these words of appreciation to Commissioner Goldstein, as well as to our friend Secretary of Health and Human Services, Dr. Kiyomi Mahania.
Sure will.
Thank you. And the gift that I'll give you at the end. Also at DPH, we have so many teams to thank, but in particular, Bureau of Substance Addiction Services team members, raise your hand and stand up. And Laboratory Sciences. Thank you to our past CEO of over 30 years, Sue Jones, who wrote endless grants and advocated tirelessly for these projects to come to life. Sue, you began the vision years ago, and we are thrilled that we can all celebrate the project's completion this morning with you. Thank you also to the Yaki Foundation for their support, which allowed us to purchase new equipment for eye services. Unfortunately, Alicia Verity of the foundation was not able to attend this morning, but we appreciate her and the team nonetheless. And of course, thank you to our architects and construction company who brought our vision to life. As I said, I brought the renderings to IRL. And if you know, you know. That means in real life. That's my teenager children, trying to keep me trendy. And again, thank you all for being here. I think the last thing I'll say is just a shout out to some of our staff who have also been working tirelessly to bring this vision to life. Mike Jocks, Facilities Director. Pickover, Director of Substance Use Services. Jessica Prince, our Chief Operating Officer. Bob Ross, our IT Manager. Patricia Neal, Director of Nursing. Dr. Mike Sianka, Chief of Eye Services. Dr. Shabana Naz, our Chief Medical Officer. Mel Benson, our Chief Financial Officer, who's not here, but Maria Anderson, Controller, is right now. Please confirming. And then Dr. Joe Panario Langer, who's not here to celebrate with us this morning. He's our Deputy CEO. We'll cheer for him, but to be fair, he's in Hawaii, so that's...
So, good morning, everyone. I'm not going to be long, don't worry about it. I'm going to be quick. So, today, if I have to share something with you, it's all about overcoming challenges. So, turning obstacles into opportunities. So this is what it is here right now today, right? So if I have to quote, let me try to get a quote from my one of my favorite actor, Denzel Washington. So this is, I'm quoting him today, right? All right, those are not my words, but. So we know life is a journey that's filled with challenges, but it's how we face them that defines who we are. Challenges may test our patience, strength, and determination, but they are also opportunities to grow, learn, and become stronger, as you can see. Every successful person you admire today, let me tell you something, has faced obstacles along the way. Is that true, Sue? Tell me if it's not true. So what set them apart is their mindset. They didn't see challenges as barriers. They saw them as stepping stones. Just like teachers, they embrace failure and turn adversity into advantage. To overcome challenges, the first step is to believe into yourself. Confidence and positive attitude are your best tools. Remember, no mountain is too high if you take one step at a time. The best thing to do is break down your problem into manageable tasks. Focus into solutions rather drilling into the setbacks. Resilience is key. The road might be rough, Maria, but persistent will always lead to progress. Surrounding yourself into positive people that will lift you up, rather put you down. And trust me, never afraid to ask for question when you don't understand. Always ask for help, and you will lead the way. You will be successful as a whole, just like the Neighborhood Health Center. And before I leave you today, I always try to bring my personal life into this because I want to thank every single one of you that contribute into the Neighborhood Health Center, direct or indirectly. Because if it wasn't for this, the Brockton Neighborhood Health Center, I would never be here with you to talk to you. But no matter how you do, Maria, the staff, we want to thank you. I'm a board member since 2008. So that means I'm giving back what I get from this place. So, and I want all of you to take that with you. Personal life, in your life, always think about it. Resilience is key. The road may be rough, but persistence will always lead to progress. Thank you so much.
Thank you so much, Cynthia. That was beautiful. So moving on with our speaking program, I would love to invite the Congressman.
Good morning, everyone. This is such a beautiful morning and a beautiful beginning for this part of the health center. My wife Margaret is the Director of Development for the South Boston Community Health Center, and my niece Casey, who just got married on Saturday, we had a wonderful wedding. She's the director of operations at that same health center, so she runs the physician's practice. So I know way too much about health centers. I just want to say thank you to Sue Joss. You know, they mentioned that she had worked here for 30 years and led this organization, but people need to know that she was violating the child labor laws when she started here. She was a very young woman and had a lot of good things in front of her. I remember the first day that I came here with Mayor Jack Units, and we were climbing over people because there was certainly not the space we have now, but we were just oversubscribed. So I've been through the wars here at Brockton Neighborhood Health Center, and I've had a wonderful group of partners, I should say. A wonderful state delegation that's been fantastic. And the federal money that came here through a program where it's called a community priority funding program. So the federal money came here differently. It was a new program. And it requires that it not be the wish of the member of Congress that the money should come to a certain facility. It has to come from the mayor. It has to come from the city council. It has to come from the state delegation. They're the ones that make the offer. We had bad experiences about 25 years ago where people were building bridges to nowhere, and those funding decisions were made by members of Congress, and they were wrong. So we changed this around so that now the local community decides what is a priority, and that's why, you know, Mayor Bob Sullivan began the whole idea that the money should come here. He looked around the city and said, who is doing the most work for the people we worry about the most? And that is here at Brockton Neighborhood Health Center. So this is a team event, right? It's all my colleagues in the state delegation, Mayor Sullivan, the city council, everyone coming together to make sure that the resources are put in the right place. We're in a very challenging moment right now, and I'm going to get a little bit political, but Congress, you may not have noticed, but the government is shut down right now. Yeah, the federal government is shut down. We went down, the Democrats went down Monday and Tuesday of last week to try to encourage the Republicans to come in and work out some of the funding, including the National Community Health Center funding bill. And I know President Rita is back there, and he's been doing great work down there as well. And Michael Curry here at the Massachusetts level trying to get some energy behind those programs and the idea that of what will happen if we don't get that funding through. The good news is that even in red states, even in Republican deep red states, they love their health centers. When you think about some of these more rural states, Utah, Wyoming, Montana, if a community health center closes in a community in one of those states, that community would have a 4-hour or a 6-hour or an 8-hour drive to the next community hospital, or if they were lucky enough to have another community health center. So there is bipartisan support in Congress for funding community health centers, but the government is shut down right now. And in order to get any of that bipartisanship together, we have to go back into session and figure these problems out. And that's why the Democrats refused to say yes to the continuing resolution that they were trying to pass, because it did not include funding for the health centers. It did not include Medicaid funding. There's a $1 trillion cut coming to Medicaid. And for my district, and I know we have Brockton Hospital and Good Sam Hospital here today, that means a lot not only to the community health centers, but also to our local hospitals. It puts tremendous pressure. Some of our institutions, some of our health centers, some of our hospitals, some of our nursing homes have 30 to 40% of their funding coming from Medicaid. So if we don't get that, after what we just went through with Stewart Healthcare and their bankruptcy, we have a lot of wobbly hospitals right now across the state. And they need that funding desperately. And so we cannot, Congress cannot, in good conscience, allow a bill that the Republicans have put forward that provides tax cuts to the wealthiest people in this country, but yet cuts services to the most desperate and needy families who live among us. We can't do that. That would be unconscionable. So that's why the government is shut down. That's why we're fighting this fight on behalf of the people that you work for every single day, that as board members that you represent every single day, that as people in the healthcare industry we work for every day and we worry about, and who are so vulnerable. So, I mean, I remember not long ago during the pandemic, Mayor Sullivan and I came here to announce a funding grant for this health center, another one back in the day. And it was during COVID. And I asked Sue, Joss, and Marie, I said, how are we doing with COVID? And they said, well, we're doing our best. And I forget, there were like 30,000 people who had come and either got shots or tested or whatever, crazy numbers. But she also said 80 of our staff were exposed and got COVID in the process of providing that care to the community. Heroes, every single one of them, to put themselves in harm's way to protect a vulnerable community. But that moment, that shining moment, it demonstrated to me the love and care that this Brockton Neighborhood Health Center has for the people who live in the city of Brockton. And that needs to be supported in the most prominent and most sublime way that we can. And so I just want to thank everyone who's affiliated with the Brockton Neighborhood Health Center and the elected leaders my brothers and sisters, elected leaders who also work on these problems. So I'm delighted as well. In closing, I'll just say that I'm very much involved in the recovery community. I was a client at one point in my day, had some difficult times, and I'm so thankful it showed me a different path. And just to know that in this new edition that we're going to be doing God's work. Yes. Well, you're going to be doing God's work. And rescuing people who also need a second chance. So thank you all so much. Thank you.
So Maria knows that I'm a student of history. Sue knows that as well. And I'd be remiss if I did not start off this conversation or this celebration today with a little history. This is the 60-year anniversary of the Health Center movement. That's worth a round of applause. And for those who don't know, I teach a class at Suffolk University on healthcare policy and healthcare administration, and we're in the 4th week of that class. Many of the students all the students come from health centers across the state, including Brockton. I want to start off with a line from Jack Geiger from the book Out in the Rural. And the professor in me is giving every one of you this homework assignment that you have to read Out in the Rural. No one's writing it down. It is required reading. And the reason why I say that is because, as I've said to those students, when they come to this class, you show up differently when you read that book.
Yes.
You understand what it means to open new sites, new departments, the impact it has on a community when you read that book. You understand what it means to bring a new physician into your community and how many patients they'll see. What it means to have community health workers serving in your community to bring patients in and to meet them where they are. So I'm going to encourage you, if you've not done that, elected officials and others in the room, download. You can even audio play the book now. You don't even have to read it. You can literally get in a car and it'll read it to you. So this is a line from Jack Geiger in that book on chapter 3, Delivering Healthcare. To treat symptoms and then send patients back unchanged in knowledge, attitude, or behavior to the same physical and social environment, also unchanged, that overwhelmingly help produce their illness and will do so again, is to provide antibiotics for cholera and then send patients back to drink again from the Broad Street pump. The whole notion that you're sending people back to the conditions that made them sick, then you're waiting for them to come back to treat them again. So I want you to think about the critical role that Brockton plays in that. As was said, I have the honor and privilege of being the president and CEO of the Massachusetts League of Community Health Centers. So on behalf of all the staff at the Mass League, we are honored and humbled to be here with you. This is absolutely a movement as we celebrate 60 years of health centers, the first being in Columbia Point, the second being in Mount Bayou. I am literally getting text messages for the last 3 days because some of our colleagues are in Mount Bayou, Mississippi this week, where they are celebrating through a series of events the health center movement is launched, and meeting with folks like Dr. John Hatch, a phenomenal leader from our movement. So I'm pleased to be here and to celebrate with you. Brockton, as you know, is known as the City of Champions, and there's no better champion for health and community than my good friend Maria Celli and her former predecessor, Sue Joss. Maria has been part of the Brockton Neighborhood Health Center team for nearly a decade, and throughout her tenure, she has always put the needs of community above anything else. We're here today because of her commitment to Brockton and her vision for a healthier, more equitable community. Maria, thank you for being our champion. I live just down the street, which does not explain why I was late for a few minutes. I'll explain that in a second. I also want to thank our partners in government, and here's why I was late. One, we have a phenomenal congressman. You know, whenever you're down in DC, and many of us just got back from DC, many of us are on these national calls around some of what Congressman Lynch mentioned we're facing across the country. I always tell people I actually don't like living in Massachusetts because I believe I was meant to live in a warmer climate, and I was born and raised here. But whenever I'm on those calls with the congressman and his colleagues, I thank God I'm in Massachusetts. No, that's worth a round of applause. Because our elected officials absolutely fight for the things we say we care about. Access for all, health equity, justice. And this congressman to my right is a staunch leader of all those. Now, the reason I'm late, I'm gonna blame all of you to my left. Financial distress that health centers are facing, including Brockton across the state, is real, and it predates the federal threats and the potential cuts to Medicaid, coming threats to Medicaid. We have a phenomenal legislature in Massachusetts who just put aside $35 million to provide some financial distress relief for community health centers across the state. And they deserve a round of applause, please. So if anyone had told this kid who came from a housing project that I would help raise $35 million and it wouldn't be enough money, but it is enough to help them really address the short-term and maybe mid-term financial challenges that they're facing. And we owe a debt of gratitude to our elected officials in the legislature and to the Healy administration for putting these resources in play for health centers to protect and sustain their services. So again, that's why I'm late, because I was on a call with your colleagues talking about $35 million. Today we unveiled 2 new spaces that will expand access to a host of clinical and supportive services. The expansion is designed to better integrate primary care with Brockton Neighborhood Health Center's specialty clinical services so they can better address patients' needs. This alone is reason enough for celebration, but I want to focus on what this means for the community. Brockton is home to a vibrant and diverse population, but far too many experience poor health outcomes because they can't access the care they need. According to the CDC, the Center for Disease Control, in 2023, 1 in 5 Brockton residents had not visited the doctor in the past year, and 1 in 5 reported frequent mental distress. Every person in this city deserves quality, culturally proficient care. This expansion will help make that possible. Another round of applause for Brockton, please. Primary care is now accessible to those who need it most. This means more opportunities for checkups and screenings that can save lives and prevent costly trips to the ER. These new spaces will be a source of hope for those fighting addiction. Here, they can receive the medication, the counseling, the supports that make the path towards recovery more manageable. For our patients re-entering the community, this site will be a haven for them, a place where they can get connected to the resources they need to take care of their own health while building a brighter future. This is what the health center movement is all about. As I talked about 60 years ago, those architects of this movement had this in mind. We understand that physical, social, and mental well-being is all interconnected. By offering a comprehensive services under one roof, we take care of the whole patient. We innovate and we adapt to meet the needs of our communities, improving health outcomes and building, again, a better tomorrow. We're gaining ground at a time when it feels like things are getting worse and against us. With our dedication, the allyship of our partners, and the proven impact of what we do, we will keep moving forward despite adversity. This expansion is a powerful reminder that what can happen when we work in the spirit of community and togetherness. Let's celebrate today, and let's also channel this joy into doing more, pushing even further in the name of health equity. I would be remiss if I did not take a second to acknowledge my friend, Mayor, who, when he took office, called me and said, Mike, I want to talk to you about the health center. I want to talk to you about the work that we're doing in the community and what you think we could be doing better. And Mayor, I just want to say, I wish all mayors and town managers acted like you did, which is reaching out in the community and asking folks about their input. So I just want to say thank you to you, Mayor. Thank you.
It is so fantastic to be here. It is so fantastic to be here. This is the best way for me to start my week. After I leave, yes. After I leave you all today, I am going to hop in the car and I'm going to go maybe 60, maybe 90 minutes up to another community health center and see patients all afternoon. Another community health center that started in sort of a little bit of a borrowed space from a local church. These community health centers are part of the fabric of their communities, and this work is incredibly hard. And it's days like today that reconnect us to the joy that you were talking about, and that also reconnect us to what's possible despite all the challenges that we are facing. Yes. When I hear about the expansion of primary care services, I think about how incredibly difficult it is in this state, but particularly in the city of Brockton, to find a primary care doctor, to find prenatal care services, to find recovery services. These are challenges that the entire state is facing, and when I come here to this community health center, is a community health center who is finding a way, despite everything else, despite all of the hurdles in front of us, finding a way to move forward with solutions. What an incredible space this is. What an incredible space this is. Whether you have been doing this work for a day or a week or decades, when I look at this room, I see people who are motivated by love, who do hard things because they care about the person next to them and the person that they cannot see, who've been doing it and who are going to keep doing it. And we need each and every one of you. The fact that you have this space that is forward-looking, that integrates the care that people need, that puts people at the center of their care by doing so. I walked in this morning and I was like, oh, a pharmacy. Like, wow, right? Wow, right? When these things come, when we build these structures around people who need help, it makes it easier for them to get the help that they are looking for. And when we build the roots into the community, and that is what I see here in this room, with the board, with the support of elected officials, local and statewide, with community members in the room. This is what it means to be a community health center. I am so proud to be your colleague. And I'm so proud that as the Department of Public Health, we get to support the work that you all are doing. I'm gonna race off and see some patients. I'm so sad I'm gonna miss the tour. I know, bummer, but I'd love to come back some other time. And thank you for everything that you have done to open this new space in this fantastic and historic facility. Thank you all.
Thank you so much, Dr. Zeidman. Next, Mayor Bob Sullivan.
Well, good morning, everybody. I am so excited to be here. I also want to recognize our dear friend, former mayor and now Councilor at Large, Moises Rodriguez. Thank you for being here, Councilor. So this is a phenomenal day for the Neighborhood Health Center, and I want to congratulate Sue Joss and Maria Celli and all the clinicians that are here, but also it's a team effort, right? So it's the administrative staff, it's the greeters downstairs, it's the security guards, it's the custodial staff, it's everybody. But I have to personally thank Congressman Stephen Lynch because he was a little modest. We would not be here today without Steve Lynch. That's a fact. He is a catalyst for this today. When we look back in time and the pandemic was starting to rear its ugly head here in Brockton, it was Steve Lynch that called me and came to City Hall, and we had our masks on, and his whole viewpoint was, what can I do to help? And that's why we're so fortunate to have him as our leader in Congress, because if you haven't watched his videos on Facebook, please do, because it's rewarding and it's what a public servant should be doing each and every day. So we're very fortunate to have the all-star here with Mr. Lynch. Thank you again, Stephen. I also could say that the same thing about Michael Curry, Attorney Curry. Living in Brockton, always advocating for our city of champions, always working with a wonderful governor and lieutenant governor and Maura Healy and Kim Driscoll, wonderful state delegation we have here. I mean, just really great public servants. But why I'm so excited to be here as the mayor and as a lifelong Brocktonian is the magic that's done each and every day under the roof of this building. And so the expansion of this floor, the 5th floor and the 4th floor, providing more opportunity to see patients, providing opportunity to see specific patients with certain ailments, to be able to help those dealing with mental and emotional health issues, dealing with drug and alcohol abuse. It's running rampant, right? Substance abuse is a real disease. And the magic that happens here, and also at Brockton Hospital Signature Healthcare with Bob and with Matt at the former Good Sam, which is now BMC South. And we can't forget the VA hospital that goes to bat every day for our vets. None of us would be here, and we wouldn't be in the greatest country in the world without the sacrifices of our vets. But I'm here today to just say thank you to Maria and thank you to Sue and thank you to everybody that works every day, because you do save lives here in Brockton, but it's also beyond. And I know that to be a fact because, again, to talk about, COVID, we lost 549 residents. 549 souls perished because of that deadly disease. But the numbers would have been a lot higher in Brockton, a lot higher. We were second in the Commonwealth to Chelsea, a loss of life. But I remember specifically dealing with the Congress saying, what can we do? And at that time it was Charlie Baker and Karen Polito, the State House, and they were great to work with. And I said, what can we do to help our homeless population at Father Bill's, which was right down the street? And without skipping a beat, and I remember it clear as day, it was a Zoom, Sue and Maria said, we'll help, what can we do? And so we worked with DPH and we worked with the feds and we got tents and we put tents outside, and it was Sue and it was Maria and it was a team at Neighborhood Health Center that went to those tents to give the homeless population, the most vulnerable people in our community, shots. And then Bob Kraft and his wonderful family and foundation donated a vehicle. And this was at the height of COVID. And Mr. Kraft and his son came down, and we met right behind City Hall, and they used that vehicle to go around to our elders that were stranded in their own homes, right? And always understanding that the city of champions is a city of immigrants. It always has been, right? It's a wonderful, inclusive, welcoming community. But to be able to speak the language of Haitian Creole and Cape Verdean Creole and Spanish and English and helping everybody in the community. There's a calling when you're a medical clinician, right? If you want to work for a health community center, there's a real calling. And Congressman Lynch is being, again, a little modest. His wife is doing it each and every day in Southie, right? And his niece, and congratulations on the wedding. But really, that calling is something that not everybody has. And they are heroes, the people that go in harm's way. But even on a good day, a non-pandemic day, They're heroes because they're here to listen and learn, but to help and provide care. So this money, this investment in the City of Champions is greatly appreciated. But it's not just appreciated by me as the mayor, as a Brocktonian, as a dad of 3 kids. It's appreciated by the 106,000 residents in our fine city. Because this health center, each and every day, is open to business. And that business is the people business. And so all of us, no matter what we do in life, if you're a U.S. Congressman, or you run the Haitian Community Partners, or Moses with Cape Verdean Association, or Bob and Matt, it doesn't matter what you do, or the Chief of Staff, we are in the people business. And I would challenge all of us, not just a fiduciary duty, we have a moral duty to continue to help people, to provide them the exceptional health care that every community, 351 communities, deserve in the Commonwealth. But Brockton is special because we are the City of Champions. It takes a champion effort to work each and every day, to come to work with that smile on the face and provide care. And it's not 9 to 5 or 8 to 4, doctor, you know that. You're here until the last patient walks out the door. And then your duty is relieved, but then another doc comes in, or a PA or a nursing individual comes in. So again, as the mayor, I thank you all. Father, I'm gonna ask you to keep praying for this wonderful, wonderful community health center, and we are all in this together. So my Nana was an Irish immigrant from Ballyhonus in Ireland, which is in the west part up in Mayo. And she had the thickest brogue you ever heard. But Nana would always say this to me, Bobby, roll up your sleeves and get the job done. And that's what we do here each and every day at the Neighborhood Health Center. So let's continue to work together. In just 3 months, I'll be the former mayor, but I'm not going anywhere. I'm gonna help this community health center. So again, yeah, God bless the board directors that volunteer their time. God bless each and every one of you for being here. I thank God every day we have Congressman Lynch and Michael Curry and the likes of these individuals. And let's keep giving the eyes on the prize. Don't listen to the naysayers. Don't listen to the craziness coming out of the White House. Let's do the right thing. Keep providing health opportunities and services and clinicians to the City of Champions. God bless you all.
Thank you so much. I would love to invite, who are already coming up,